Hello, this is Mark Piper. Today I'm going to be talking to you about oxygen therapy. In EMS, oxygen is used to treat hypoxia. Oxygen has other uses in the medical system, but in EMS we only use it to treat hypoxia. You can also use it to treat or help with cell metabolism. The air has 21% of oxygen in it, but normally we give patients 100% of oxygen. In my department, we administer oxygen via either a nasal cannula, a non-rebreather mask, a bag valve mask, a CPAP, which forces air into the patient's lungs when they take a breath in, or via a nebulizer, which when we give medicine to the patient, the oxygen helps to form a mist, and it administers the medicine deep into the patient's lungs. We used to believe that oxygen didn't hurt anybody and not to withhold oxygen, that everybody got oxygen. But we've since learned and changed our protocols so that only a patient with an oxygen saturation below 95% will get additional supplemental oxygen. Oxygen has vasoconstrictive effects on the circulatory system, and it reduces peripheral circulation, and they say it increases the effects of a stroke. To determine that reading of that 95% on the pulse ox, we have it's a device that we stick on the patient's finger, and it will read the hemoglobin that's attached to the red blood cells and give us our reading. In the truck, we carry our oxygen in cylinders. We have a portable cylinder, which is a size D, which we take to every patient. It's attached to our stretcher. We hook them up there on scene, and we'll bring them back to the truck, and we'll switch them over from that small cylinder to our main oxygen cylinder, which is attached to the truck. And when we get to the hospital, we're transferring the patient back over to the nurses. We'll put them back on our portable cylinder. Oxygen is also used to treat decompression injuries, the bends normally for divers. We'll take the patient to a facility that has a hyperbaric chamber, and they will begin recompression in a hyperbaric chamber, where the patient will be breathing in and receiving 100% oxygen, and that's the standard treatment for decompression illnesses. It's also used to treat wounds and treat burns.